Congressman, is there going to be a bill passed by the U.S. Congress tomorrow for health care or not?
Chris, there's real problems. I mean, first of all, another $1 trillion proposal. I mean, how many of these come along again and again? We had the bailout with the AIG. Then we had, the stimulus with AIG pay raises in, $1 billion here, $1 billion there, and now we're talking about another $1 billion on top of this. And a lot of people, Democrats, are very uncomfortable with this. You've got issues like why abandon the verification system to make sure that illegals don't benefit through this program, a system we've had for over 15 years. Why retreat from that? There's a lot of big questions, and the biggest issue is how are you going to pay for it? How are you going to justify it when you get back and talk about what the long-term impact is on this country? Because remember, if this is so critical to do it so quickly, why are they putting off implementation until 2013? They start the taxes right away, but benefits don't show up.
When did the Republicans have a health care bill that they were trying to get through ahead of this one? You guys were in power for years, and you didn't do it. Why do you keep saying the Democrats are moving too fast? Democrats started working on this with Harry Truman back in the late 40s. They're finally getting it done, and you're saying they're moving too fast? A half century?
Chris, when I was in the 90s, I raised the issue. As somebody who had to supervise the health care system for 3 million people in San Diego County, I knew that the tort issue and liability was a huge issue that we had to address. And now they're talking about that it's sitting around $45 to $55 billion price tag that we could be using for providing health care to those who need it.
Yeah, I know you have arguments, and I agree with you, by the way, but the Democrats are in bed with the trial lawyers, and it's never going to happen. So let's stop the stupid argument. It's not going to happen tomorrow. What's going to happen tomorrow is a health care bill or not. Congressman Bilbray, is it going to pass tomorrow or not? Whether you like it or not, is it going to pass tomorrow?
I think, after talking to the moderate mainstream Democrats, I think it probably won't.
It probably won't. Let me ask you, Congresswoman, you're on the show a lot. I trust you. Let me ask you about a couple of stumbling blocks.
Sure.
Abortion, will it be covered in the bill in any way? Number two, will any illegal, undocumented worker benefit from the bill? Yes or no to two questions?
Okay, to question one on abortion coverage, it maintains the status quo. So it does not provide any federal funding for abortion, just like the Hyde Amendment is in federal law now, preserves the status quo and treats abortion exactly like it always has been since 1976. On immigration, no. The answer is no to that question as well. It does not cover illegal immigrants at all, does not allow them to participate in the healthcare system, in the new healthcare reform system in any way. But what I don't understand, Chris, is why Congressman Bilbray represents the 50th district in California. I really don't understand why he wants to continue to walk down the streets of his community in San Diego and look at 1 in every 10 people in his district, in the 50th district in California, and look them in the eye who don't have health insurance. 1 in every 10 people in his district don't have health insurance. That's 61,000 people. But that's okay with him. It's okay with him to continue to be a member of a party that has health where health care is reformed.
But you're not talking about illegal immigrants, are you?
No, I'm not. No. I'm talking about
you're talking about people can't get in the country legally that aren't getting health care. Okay, let me ask Congressman Bilbray. Before you answer Congresswoman Wasserman Schultz's question, which you may want to do at some other time, I want you to answer my question right now. Is there a health care is there a measure in this bill that pays for, in any way, someone having an abortion procedure? First of all, is it paid for in this bill?
The abortion issue is being involved by the fact that you are not you're not allowing people, you're not having a system that makes sure that abortion stays out of any publicly administered program.
That's simply not true. That's absolutely not true.
Well,
you're entitled to your opinion, but not entitled to your own facts,
I'm not raising that issue. A Democrat from Michigan is raising that issue. The issue I've been raising is that if you do not require that you check that somebody is legally in the country, the gentlelady from Florida knows, with a wink and a nod, you're allowing the illegals in. And frankly, the issue about her district or my district, it's about America. It's about our
That's right. There's 46
our seniors, and it's about our grandchildren.
Okay, let me narrow it down for both of you.
135,000 people in my district.
Let's help the viewer a little bit here. Congressman, first, you're a Republican. You're not going to vote for this bill, hell or high water. I know that. But let me ask you about the one fact. I understand that there's no subsidies in this bill for someone in the country illegally. Is that what you understand? No subsidy for anyone in this bill who's not in this country legally. Isn't that right?
First of all, the subsidy
is isn't that right?
No, the subsidy is the administration of the program. And, Chris, one of the biggest problems we have is
No. Why are you changing my language? There's no
I'm not.
subsidy.
The subsidy is the administration of a program that specifically tells illegals, we have a program you can participate in, and the American government...
There is absolutely no way for an undocumented immigrant to participate in this health care reform plan.
Look,
There's no
you can't even say the word illegal. They're illegal. And the fact is,
undocumented. I said illegal 3 minutes ago.
She doesn't have to bash people here illegally to make your point, sir. Isn't it true that what you're talking about here is that the exchange program, where you're allowed to buy into an insurance program exchange that's a government program that helps you understand how to get the best deal, they can participate in that, but they don't get any subsidy. Isn't that right, Congressman?
What you're doing, Chris, is you're telling them the American people will allow you to participate in a program, and that is the kind of mixed signals that tells everybody, come here illegally.
Look, that is
where we get frustrated with.
But no subsidy. We agree there's no subsidy. Let me ask you about the abortion problem, Congressman Wasserman Schultz. Congresswoman, it seems to me there's a real problem here because people... The pro-life people, a lot of them really do believe that if you give a person a subsidy for a health care plan, even if they had the plan before this bill came along, that's subsidizing abortion. Do you look at it that way?
No, I don't look at it that way. But the point here is that in order to make sure that we can have comprehensive health reform, Chris, I'll tell you, the language that's in this bill on abortion, I'm pro-choice. And many of my pro-choice colleagues have made a compromise just by being willing to look at the broader issue and support health care reform and have language in there on abortion that doesn't make us comfortable. We've got to come together, meet each other in the middle, and both pro-life and pro-choice members, at least on the Democratic side, understand that. And that's why I've been working so hard to get us together so that we can pass health
reform of the exchange program, no participation. Will you push and say no money can go for subsidizing a health care plan which includes the procedure of an abortion? Will you do these things so that you can get 218 votes tomorrow? Is that your plan, sir?
That
to get this amendment through,
that we use the verification system for this program that we have used for every program the last 15 years, that we draw a bright line, that government's going to stay out of abortion, that it should stay totally out of it and not be involved in any way financially or administratively.
Chris, they will.
Okay, that will be in the motion to recommit. Will there be something in there about illegal immigrants in the motion to recommit?
Absolutely. We'll go back to the system we used for 15 years that they're retreating from and abandoning.
Reform. The Republicans are opposed to health care reform. That's evident in the bill, the so-called bill that they put forward that only covers 3 million people, that doesn't even prohibit insurance companies from dropping people or denying them coverage based on a pre-existing condition. They should be ashamed of themselves. This is one of the most important priorities for America to take care of. Health care should be a right, not a privilege, and we need to make sure
here's
that
what I think is going to happen tomorrow.
If you want
Congresswoman, I want you to finish up this tomorrow. I want people to understand what's going to happen tomorrow, and I think this is going to happen. I think the Republicans have given up on passing their version of health care reform because they just don't have the votes, and I don't think they have their heart in it anyway. So what they're going to do tomorrow is try to amend the Democratic bill in a way that makes it unpassable. You're going to push through a really tough anti-abortion measure, a really tough anti-immigration measure, and you're going to make it maybe so attractive to some Democrats that you get 218 votes, thereby creating a mutation of the Democratic health care bill that not 218 Democrats will support, since all you guys will then vote against it. Isn't that your master plan tomorrow, sir, Mr. Bilbray?
No, Chris,
is that your plan?
Wait, Chris. We will not be allowed to do any of those amendments. We will not be allowed to even...
That's what your motion to recommit will be, Brian. You know what he's talking about. In your motion to recommit, you are going to try to derail health care reform by including those issues that he just... Chris
no, the motion to recommit will have a separate bill that addressed tort reform for $50 billion we could use for health care. That's what it'll include, something that the Democrats don't want to touch.
Okay.
Well, that's true. So. By the way, the Democrats won't vote for that much,
take on the
I don't
lawyers.
think I'd worry about that tort reform job of yours because the Democrats aren't going to vote for it. I'm not going to tell you to do it smart because I don't want to see you destroy the bill. Anyway, thank you, Congresswoman Debbie Wasserman Schultz. Thank you so much for